The simple act of breathing is not something most people think about. But if you're struggling to breathe, it's the only thing you can think about. It's a matter of life and breath. You may not know it, but you need a respiratory therapist. The respiratory therapist is one of the most critical members of any healthcare team. In the 24/7 world of medical care, RTs work closely with doctors to diagnose, treat, manage, and educate patients with asthma, emphysema, and a wide range of other respiratory problems, from premature babies to the elderly, from the ambulance to the emergency room, from the hospital room to the patient's home. Respiratory therapists are there to help you breathe easy.
I just like the fast-paced, the anything can happen kind of environment.
Nothing ever stays the same, so you have to be ready to improvise at a moment's notice. Patients' lives are in your hands many times.
There's always something going on, you're moving all the time, so being a therapist is a very rewarding job.
Lung disease is on the rise, and respiratory care is among the fastest-growing specialties in healthcare. That means a rapidly growing need for professional respiratory therapists. And salaries are rising right along with the demand.
You are, what I was told in school, the experts in the cardiopulmonary aspect of patient's care.
There's usually one of the first ones at the bedside to assess the patient. There are eyes, there are ears when it comes to assessing the respiratory status of a patient.
It is extremely important to have very knowledgeable respiratory therapists with strong communication skills that can work as a team, as a member of the team.
Respiratory therapists are needed in just about every facet of the healthcare system, from diagnostics and patient evaluation to treatment and rehabilitation, from physician consultation to patient education, from rapid response emergency care to long-term case management.
Breathing great. So this is
I love respiratory care. You come in every day, you never know what kind of challenge you're going to face with. It's exciting, the adrenaline is pumping.
You learn new things literally every day.
It's exciting because it's a challenge. I mean, every day there's a new ventilator, there's a new practice.
The career of just about every respiratory therapist begins at a hospital. That's where you sharpen your clinical and bedside skills. It's where you treat every kind of patient and every manner of pulmonary disease and trauma. It's where you become proficient in the use of the very latest respiratory tools and equipment. And it's where you earn the respect and trust of physicians and nurses as a valued member of the healthcare team.
As a physician, I think the respiratory therapist is critical to a medical practice. They work in all areas of the hospital, they work in outpatient settings, and they work in office settings.
Patients in need of respiratory care can be literally anyone of any age. Premature infants who need a ventilator to breathe, young children with asthma, adolescents whose breathing is impaired due to trauma, adults with sleep disorders, and older people with chronic pulmonary disease.
Respiratory therapists are the health care practitioners that have the most knowledge, experience, and training in disorders dealing with lungs.
Other healthcare professionals do not have anywhere near the background in breathing that respiratory therapists have.
Your assistant has to do with how...
Though most respiratory therapists begin their careers at a hospital, many move on to work in other settings. Doctors' offices and clinics, diagnostic labs, children's hospitals, nursing homes, corporate and industrial settings, even patients' homes.
You get to learn all these new technology that's coming out in the field as far as with ventilators, and we have BiPAP machines.
You can take care of neonates, little tiny preemies, you can take care of adults and that whole gamut in between.
You can work for anybody, hospitals, rehab center, nursing home, care flight, you know. So I like the profession and I'm enjoying it.
Respiratory care is a profession that's always been known for its sophisticated machines and diagnostic tools. Much of what respiratory therapists do is closely tied to medical equipment, like aerosol delivery devices, airway clearance devices, sleep therapy equipment, and ventilator systems, just to name a few.
If you have a knack for toys and tinkering, and you have that mechanical inclination, plus you want to really do something to help patients, that this is the field for you.
You know, healthcare is always changing, so you have to keep up, you have to learn.
There's always new equipment coming out, always new and different ways to do something.
What I've always appreciated about every respiratory therapist I've ever have known is that they're so adaptable.
Now we have computer touch screens where we were dialing stuff. So each year, like as technology progresses, so are we progressing.
There's all sorts of different machines out there that you're going to have to learn how to use and to work with. And you're basically there to keep that patient alive and breathing and keep them comfortable.
Hundreds of colleges and universities offer 2-year and 4-year respiratory care programs, which can lead directly to a credential as a respiratory therapist. That credential opens the doors to one of the most exciting specialties in healthcare.
It's amazing and it's a wonderful feeling to see patients get better and go home, to walk out as one big happy family.
You are there supporting them, giving them life. It feels great.
I'm a people person. It's nothing better than to see them smile.
It's incredible. I mean, it's just an incredible feeling to see patients get well, get out of the hospital, and see them improve.
And if you weren't there, they wouldn't have been alive today. And to see them to be able to walk out of the hospital, that's where it's great.
Respiratory care is a field that can take you anywhere you want to go. You can get into pediatrics, home care, research, education, management, acute care, long-term care, sleep medicine, disease management, and as a respiratory therapist, you can work just about anywhere.
Any day, you can pick up the phone and have a career at your fingertips and never be without employment.
I love being a respiratory therapist. I wouldn't do anything else in the medical profession.
There's always going to be many, many opportunities. There'll be a lot of doors open for you.
It's probably one of the best decisions I ever made.
Want a job you love? Visit the AARC website and explore the career options in respiratory care. Respiratory therapists who specialize in continuing and long-term care see patients with severe respiratory problems, including chronic diseases such as emphysema or chronic bronchitis. Often the patients are elderly, but that's not always the case. They may see patients whose breathing is impaired because they've been in a trauma like a bad auto accident, and that can include infants and very young children. They may be on ventilators or need artificial airways, such as tracheostomy tubes. One place a long-term care specialist may work is in a long-term care hospital.
Usually the patients we see have a lot of hope has been given up on them. You know, they figure they're ready to go to a nursing home or skilled nursing facility, and they come to us and we work as a team and get them well to where they go back home.
In a long-term care center or a nursing home, your most important job is to help patients who can't breathe on their own. You have to continually assess your patients, modify the plan of care when necessary, and work with other healthcare professionals to make certain your patients are getting all the help they need. For many of these patients, there is no cure. But a respiratory therapist helps them cope with their condition and live their life to the fullest extent possible. In critical care, the respiratory therapist sees only patients who are critically ill. Most of them require mechanical ventilation and other life support systems.
My most favorite place to be was the ICU. It provides you with the best place to learn and to improve your skills and to keep moving forward in the field.
It can be an elderly patient with chronic respiratory failure from a disease like emphysema. Or it might be a previously healthy young trauma patient whose respiratory failure is due to injuries suffered in an accident. In an ICU, you have to stay alert all the time. There's a sense of urgency to everything you do. You're often looking after several patients, any of which may need life-saving attention at any moment.
A really good respiratory therapist is someone you have a lot of faith and confidence in. You know when they come to you and say, I have this, you know that more than likely that's truly what is going on with the patient, and you need to get things in action and get things going.
An ICU isn't the only place where respiratory therapists provide critical care. They're also key members of transport teams, moving patients in ambulances, helicopters, and fixed-wing aircraft. They transport newborn babies who need mechanical ventilation or surgery. In the military, respiratory therapists are key members of critical air transport teams. Critical care can be exciting and urgent. That said, there's nothing in this world that feels better than saving the life of a patient who might have died if it hadn't been for you. Respiratory Care Diagnostics covers a wide range of procedures, including breathing tests, blood tests, exercise tests, and tests where respiratory therapists actually look into the lungs with a long scope that goes down the trachea. The most common test is spirometry. That test measures how well the lungs and airways work. Patients are usually referred for pulmonary diagnostics when they have symptoms such as shortness of breath. Tests are performed on patients of all ages, young children with diseases like cystic fibrosis and older patients with chronic bronchitis and other chronic respiratory diseases.
No healthcare professional is uniquely equipped as respiratory therapists are to bring to the table the skill base of why am I short of breath and looking at pulmonary issues, asthma, COPD, pulmonary fibrosis, bronchiectasis, all these conditions that everyone reads about in their textbook, but nobody does their hands-on treatment. Respiratory therapists bring diagnostic tools and therapeutic interventions that nobody else can match.
Pulmonary diagnostic work is done in hospitals, in physicians' offices, in freestanding diagnostic facilities, even in patients' homes. The importance of this job is that it leads to a diagnosis. That allows the doctor to prescribe medicines and therapies for the patient.
I rely heavily on the respiratory therapist to keep me informed of my patient's progress and what might be an advisable course of therapy.
Among the fastest growing specialties within diagnostics is sleep medicine. There are about 40 million people in the U.S. who suffer from chronic long-term sleep disorders, and more than 80 different sleep disorders, many directly related to breathing. As medical expenses continue to rise, there's a growing emphasis throughout the healthcare industry on disease management. That means helping patients take charge of their own care. In disease management, respiratory therapists typically work with patients with chronic pulmonary diseases, diseases that can be treated but not cured. These diseases diminish people's quality of life, increase the chances of mortality, and are costly to treat in a hospital.
I'm teaching people how to live with their disease, be it emphysema, chronic bronchitis, just helping them to manage through it, realize what stages they're going through, where they're at, how they can maintain, basically giving them some type of self-management so they can stay out of the hospital pretty much.
Respiratory therapists work with both adults and children on disease management and spend a lot of time with them. When the patient is a child, parents are the key. They're the ones who administer medication. They're the ones who can recognize danger signs and symptoms.
The whole idea behind the medications you take is to keep your lungs nice and open and normal so that you can do all the things that all the other kids do.
The physician really relies on the respiratory therapist to educate the patient about and help them manage their lung disease.
I know a lot of physicians whose primary practice is dealing exclusively with respiratory disease, and in their offices they hire respiratory therapists to be their physician extenders.
I've helped the families, the patients, manage their disease and take control of their lives so that they can breathe easier, and so can I.
As healthcare costs continue to rise, doctors will rely on respiratory therapists to play an increasingly vital role in disease management through ongoing assessment and education of patients with chronic diseases. As the healthcare system in general moves patients from costly acute care in hospitals to home care, there has been a rise in the need for home respiratory therapy. Home care is now provided very effectively to patients with chronic lung diseases. If it's being done in a hospital today, chances are good it can be done in the patient's home. We provide all kinds of home services, including inhalation therapies, patient education, consulting, home medical equipment, along with training and support for patients and their families. The evolution in the design and portability of sophisticated medical equipment previously available only on hospital ventilators and now in common use in patients' homes has been a huge factor in the growth of home care.
I feel that it's very beneficial to people who have breathing difficulties for someone to be there that can actually understand their dilemma, understand their medications, help explain things to them, and help them understand that they're not alone in what seems to be a never-ending problem.
As a home care respiratory therapist, you work independently and have a lot of direct contact with patients. You get to see them on their home turf, working on issues and situations particular to them. In home care, a respiratory therapist needs to be more than a respiratory therapist. Of course, you need clinical skills, but you also need to be a patient trainer and educator, an equipment expert, an insurance case manager, and a physician extender.
I have found the respiratory therapist to be the ideal person to deal with those patients with chronic disorders. They're well versed in the nature of the disease, its treatment, and they work very well communicating with patients in the setting of the home and over the telephone.
To work in home care, you need a strong clinical background. You need good people skills, good communication skills, and strong time management skills. You have to be able to make decisions on your feet and work independently without a lot of supervision. Often you act as a liaison between the patient and the primary care physician. And you have to coordinate with other agencies, like home health agencies, nursing agencies, and home medical equipment providers. It's a great job for anyone who likes to wear a lot of different hats. If you want to be a manager in the field of respiratory care, you need to get the best education you can and apply yourself with the utmost diligence to learning your profession from the bottom up. Most managers first distinguish themselves as top-notch clinicians.
I am a respiratory therapist. I did go through school and earned my degree in respiratory therapy and worked at the bedside several years before I ever took a management position.
Management and education are joined at the hip. That's because most managers prepare themselves with a strong educational foundation and an eagerness to learn on the job. For the very best respiratory therapists, the learning never ends.
I highly recommend a bachelor's degree, if not a master's, especially if you want to move into manager, supervisor, or director level. Certainly a master's would help you achieve that.
The demand for respiratory therapists is growing rapidly. That means a growing demand for leaders as well. As a supervisor or manager, you support your team to make a difference for patients. There's nothing more rewarding. You may start up the ladder as a shift or unit supervisor. That can lead to a manager's position. That's the person who oversees staffing, work schedules, and manages day-to-day operations. The next level up is director, and oversight of budget, policy, and planning for the entire department or multiple departments.
As a respiratory therapy supervisor, you not only have to have good sound clinical skills, but you also have to have good communication skills, good people skills, an eagerness to learn and to teach, because you have to teach those newcomers coming into the field.
Some respiratory therapist directors and managers even move up to positions in hospital administration.
New coming out of the respiratory profession that's going to be a president and a CEO of a hospital one day.
Many respiratory therapists take positions as managers at home healthcare companies and other corporations, or consult on product development and evaluation, or develop training programs for new products. With good management skills, your opportunities are unlimited. Every respiratory therapist is an educator, most often teaching patients how to use specialized equipment and manage their own care. But to grow your career along an education track teaching future respiratory therapists, you can become a clinical instructor, bridging the gap between the hospital and the college. Or perhaps you'll teach in a classroom, or run a program at a college or university. Through management and education, you magnify your reach as a professional by transferring knowledge and skills to others. It's the best way to truly make an impact on the field of respiratory therapy. And right now, the field is wide open with opportunity. Pediatric respiratory therapists work with newborns and children. The very youngest patients are premature infants, who are born 2, 3, even 4 months early, some weighing as little as a pound or less. These neonates and some full-term infants go into a specialized neonatal intensive care unit. In most cases, these are patients with congenital defects, valves, veins, and arteries of the heart that are missing or attached in the wrong place, or airway defects that cause serious breathing problems.
They work with very sick newborns, premature babies, and they work in the labor and delivery area to resuscitate and help stabilize newborns who may be sick at the point of birth.
Pediatric respiratory therapists also see toddlers who may have an obstruction in the airways or who've suffered a trauma. Children have smaller lungs than adults. Because of that, diseases like asthma are more severe in children. When treating children with respiratory problems, therapists use different size equipment and different settings, and the medications may be different in both type and dosage.
Respiratory therapists, because their field of concentration is on airway and breathing, that's a vital part of the care of the critically ill and pediatric patient in respiratory distress.
You're involved in almost every case, from just minimal giving the kid some little bit of oxygen to extensive respiratory care work. You are the lifeline.
Pediatric respiratory therapists can get specialized training and credentials in resuscitation and other areas of respiratory care for children and newborns.
Seeing the looks on their faces, how they interact with you, you almost become their second family here, especially if they're here for a really long time. So you kind of have this bond with them and their parents, and it's a nice family.
I love kids, and when the kids see me at the beginning, they're scared because they don't know what you're gonna do with them. But when you start talking to them, when you let them know what you're gonna do, and you play with them, with the equipment you're gonna use, they really see that that's gonna help them.
I kneel down to their level, they hug my neck and all that. The money is good, but that hug, I don't know, there's no value to attach to it. So, that's why I've been here all this time. Otherwise, maybe I could have gone somewhere else. But the children, I'm hooked on them and they hook on me, so.
Certain chronic lung diseases cannot be cured, but patients can live longer, more fulfilling lives if they exercise their lungs. Respiratory therapists, who work in a division of the profession called Pulmonary Rehabilitation, are there to help.
We teach them relaxation techniques, stress management, exercises that they can do at home, how they can incorporate at home if they're not actually going to use a facility to continue exercise management. But just teaching them about their disease, exactly what's happening in their disease, what they can expect as it continues on and progresses.
Pulmonary rehabilitation specialists can work within a special department in a hospital, or maybe even work in a freestanding rehab facility. It may look like an exercise facility with treadmills, weights, and activity rooms.
Well, respiratory therapy provides the underpinning and support for everything I do. Without respiratory therapists, I would be practicing in a wasteland. But what respiratory therapists do for outpatient medicine is that they provide the diagnostic testing to give me the information I need to make a diagnosis.
Whatever the location, the mission is the same: help patients learn to cope with their lung disease. They do this by teaching special techniques for breathing, educating patients about proper medication use, and creating exercise regimens that improve breathing. Many patients who are on oxygen may find that it is easier to breathe and they have a better quality of life.
I'm teaching people how to live with their disease, be it emphysema, chronic bronchitis, just helping them to manage through it, realize what stages they're going through, where they're at, how they can maintain, basically giving them some type of self-management so they can stay out of the hospital pretty much.
Without research, there'd be no innovation. And in respiratory care, research has transformed an entire field of medical specialty in a single generation. It all starts with respiratory therapists asking a couple of key questions. Why do it this way? How could we make it better? What works here? When we ask ourselves these questions, it can lead to fresh thinking that can make a huge difference in the care we provide our patients. To get started, find a mentor, a physician or an experienced respiratory therapist who's doing research, and offer to help. There's a progression to research: forming hypotheses, developing a theory, collecting data, recording, analyzing, and writing. From data collection, you start writing papers. Then somebody asks you to write a review article. Then maybe a book chapter. It's a good way to gain some notoriety in the field.
If you'll ask any respiratory therapist that practices today, they've either built something or probably have invented something that some vendor has come along and go, hey, that makes the day go a lot easier for these patients, and so tell me about that.
Through research, you can have a direct impact on the entire profession.